Can antiviral drugs for liver disease become resistant? Imagine taking medication to keep a stubborn virus in check, only to find that over time, it starts fighting back. Yes, antiviral drugs used to treat liver diseases, especially chronic hepatitis B virus infection, can become less effective. This phenomenon is called drug resistance. It happens when the virus mutates in a way that makes the medication less capable of stopping it from multiplying. As a result, the virus can continue to replicate despite ongoing treatment. In the case of hepatitis B, older drugs like lamivudine have a low barrier to resistance. This means the virus can easily develop mutations that make the drug ineffective. These mutations often occur in the viral polymerase enzyme, which is essential for the virus to replicate. For example, mutations in the IMD motif, specifically RTM20 for I or RTM20 for V, are common resistance mutations that reduce lamivudine's ability to work. Studies show that about 23% of patients on lamivudine develop resistance after just 1 year, and this can increase to 80% after 5 years of continuous therapy. When resistance occurs, the virus can rebound, leading to increased liver inflammation and damage. This can accelerate the progression to cirrhosis or even liver cancer. Fortunately, newer antiviral drugs like entecavir and tenofovir have a higher genetic barrier to resistance. This means the virus finds it much harder to mutate in a way that makes these drugs ineffective. Because of this, they are now recommended as first-line treatments for hepatitis B. They can suppress the virus more reliably over time and reduce the chances of resistance. However, resistance can still develop, especially if a person has already developed resistance to older drugs like lamivudine. This prior resistance can lower the barrier for developing resistance to drugs like entecavir. The consequences of antiviral resistance are serious. When the virus becomes resistant, it can cause viral rebound, leading to increased liver inflammation and further damage. This can worsen existing liver fibrosis or even cause decompensated cirrhosis, which is a life-threatening condition. Patients with resistant hepatitis B are also at a higher risk of developing liver cancer, especially if they already have advanced liver disease. Managing resistance involves close monitoring of viral levels through regular blood tests. If resistance is detected, doctors may change the treatment plan. For example, switching from lamivudine to tenofovir or adding other antiviral medications can help control the virus. Sometimes combination therapy is used, but it does not always offer additional benefits over potent monotherapy. The key to preventing resistance is to choose the most effective drugs with the highest barrier to resistance and to ensure patients take their medications exactly as prescribed. In summary, antiviral drugs for liver disease can indeed become resistant, but advances in medication have made it easier to manage. Proper treatment choices, adherence to therapy, and regular monitoring are essential to keep the virus under control and protect liver health. Always consult healthcare professionals for personalized advice and treatment plans to ensure the best outcomes.